Well, let me bring in our next guest on the program, Daniel Wells with EndeavorPlus, which is really a new health plan providing a direct path for self-funding for many, many businesses. And Daniel, welcome to the program.
Thank you very much, and thank you for giving me the time this morning.
Yeah, good to have you on here. Give our audience a little background on EndeavorPlus.
Sure. EndeavorPlus is really an integrated healthcare solution that is geared more toward that 50 to 250 life group, those employer groups, to transition them away from the fully insured commercial plans that are out there into an integrated self-funded solution that really drives consumerism, transparency, and wellness.
So what, there seems to be a lot of entries in this niche, in this space, obviously, because of, where the market's moving. So tell us what differentiates EndeavorPlus from, some of the others out there.
Well, and really what brought me over to Endeavor, too, is in that niche market that we have, it's always been an obstacle to bring those people over to the the self-funded marketplace because you're going to have the peaks and valleys. Everybody's going to have bad claims, either experienced by the group or experienced by an individual. And when you have a bad claims, that has legs, and that has an impact over years 2, 3, and 4 as your funding levels go up.
Right.
Endeavor has a patent pending program where we can actually take those claims, those high dollar claims, and purchase them off of funds that we have generated from the capital markets that allows our stop loss partners to pay those claims over time because they're trying to get into this marketplace too. But the problem is their loss ratios. So if we can take that $1 million claim from a group and let the stop loss carrier amortize that over 10 years using the capital markets, that mitigates that risk and helps stabilize that rate over time. There's a lot of tertiary benefits to that we've experienced dealing with the providers directly and monetizing their receivables. But it's a way that we have been able to, instead of shift the cost curve, sort of flatten that out.
Okay. When did you launch, Daniel? When did this become, active in the marketplace?
We've basically been actively marketing this for the last month. I gave final sign-off that we could accept membership 3 weeks ago. I've been instrumental in the integration of all the systems, and I wanted to make sure anytime we bring business on that it's going to run smoothly. So we have some really good proposals out there. We're getting a lot of good reception from the provider marketplace and also the consultant marketplace. We're bringing on. We have our first lives coming on in June. We have a bunch of open proposals, still live proposals in June, and we're looking for July to be a really boom month for us. And our anticipation is to bring on about 25,000 lives between now and January 1st of 2017.
That's a pretty aggressive growth plan. So are you going to work through brokers? Is that you're gonna embrace brokers as part of your distribution plan, or
yes,
what's your rollout?
Totally. I don't think you can feed from both sides of that trough. So we are dedicated to the independent sales force marketplace. We've developed a distribution strategy that uses a GA, an MGA, a GA, and a writing agent model. We call it managing director, regional manager, and regional advisors because it is more an advisor role in this product. But we're going out exclusively. We've developed 3 MGA producers right now that are signing up agents underneath them. They're generating a lot of quote activity for us, and they're doing a lot of education and seminars for us as well. It's really an education process to train the agents up on how to present this because we have the financial services aspect. We are a 100% reference-based pricing and price transparency shop, and the way that we only offer a single plan design. So we have to educate them on all components of our integrated solution here.
Yeah, so you're about to release a new mobile app. Is that correct?
Yes. We're really driving wellness. We put a big focus on wellness. So we always knew we had to have an interaction, especially with the millennials, to really flatten that cost curve. So we've started developing our wellness app, and it was launched last week. But Dr. Susie Shrug, one of the top 5 lipidologists in the country, was spearheading that project, and we sort of had scope creep, where it went from a wellness app where we could do tracking and you could keep track of your numbers to more of a holistic plan administration app where You also have access to your HSA. You can pay claims off of the phone. You can take a picture of a claim that you have paid and request reimbursement from your HSA account. You can also do a geo-access lookup of providers, and it's incorporated into our price transparency module, so you can see what the cost of care is. And you can actually click to call and make an appointment, or if they're hooked to the Google interface, you can click to make an appointment right off your application. So it's a more of a holistic approach to a mobile application than just a wellness app.
Well, that's pretty interesting. So you're just rolling out. So where are you? Are you focused on any one region of the country right now specifically, or are you looking to embrace distribution across the country? What's your game plan right now?
With our bond program, we really got a lot of interest in the Southeast. So we have a bunch of Florida hospitals and Alabama hospitals that want to sign up on our financial services unit. So we're pushing distribution down there in the Alabama, Mississippi, Florida marketplace. But we've really regained traction. We're out of New York, so we have the New York, New Jersey, Connecticut, Massachusetts, Rhode Island marketplace, and that's where we have the majority of our MGAs who are signed up, 2 of the 3. And they're really driving a lot of traffic there. We're also building out in the Midwest. We're doing this on a regional basis, but we're attacking them all at once. So we have the Northeast, we have the Southeast, we have the Midwest, we have Illinois and Missouri right now, and we have the West. We have Colorado, Utah, and California coming online really quick. They'll be ready for 7/1 effective dates. We are well ahead in our licensing and our compliance filings than we are in our sales efforts. We want to have our footprint in the licensing where it's not going to hold back any sales, because we have to be licensed where the members reside, not where the employees reside, the way this program sits.
So you've got you've got a truly integrated model. You've got you talked about the major medical side. You've got voluntary benefits as part of this plan design as well.
We have left voluntary benefits out as far as us integrating that, because we know that the brokers out there and the advisors out there are developing that to supplement the decrease in commission levels from the commercial carriers. So we have developed a portal strategy. So every one of our groups will have an employer member portal, the employer administrative portal, and we can load those voluntary benefits up in the employee portal and use that portal as a quasi-private exchange during enrollment. So we want to be very user-friendly to our advisors, and we didn't want to dictate who their ancillary provider should be or carrier should be. So we've opened up that gateway where we can accommodate any of the carriers that are out there.
Does the same hold true for HSA accounts? Any specifically one, or is it offer you can include whoever you're working with?
Our HSA account, we wanted to really streamline that because I needed some really robust functionality, and we elected to go with Health Equity out of Utah. A couple reasons is they have one of the most robust and user-friendly member interfaces that we were able to private label and tap into through our member portal. But number 2, we've had a lot of interest from banks and banking insurance agencies that wanted to go out and present this to their member base. Health Equity is bank agnostic, so I can take my proceeds from my HSA deposits and funnel them to the banks that I want to. And that was very powerful for us to go out there. So our administrator is sort of tied in because of the functionality, but our banking relationships are agnostic.
Daniel, if I'm a company between 250 and 1,000 and I'm still fully insured, is this an option for me, or are you strictly gearing it to the 50 to 250, which I agree with, but I'm just curious. Is that?
No, I've been really close on a 3,000 life group. Probably one of the first groups that I'm going to do in July is going to be 1,000 life. So we can take, on the upper limit, there's no upper limit threshold. And especially if they're coming from the fully insured market to the self-funded, we've put a lot of the safety nets to protect the solvency of the plan and limit the liabilities of the plan sponsor. So it adds to the cost, though we're still competitive with the commercial carriers. When you get into the bigger companies, they have more cash flow flexibility, and we can pull some triggers and actually start reducing their cost on the administration because they can pay as they go. So it's a good fit for everybody. The way we've structured this is that integrated hub and spoke type strategy, so we can plug and play and manipulate where we need to manipulate to bring those costs down.
It's so when you look at the emerging private exchange market out there, is this an alternative, or can you work with, or tell me how that can work?
We probably are not going to be set aside unless we have a mega group for a dual option plan, which would be the true private exchanges where you need to have choice. We only offer one plan design, and there's a multitude of benefits by offering one plan design. It's a qualified high deductible health plan. It's mirrored with the HSA that includes employer-funded HSA. And it allows us to really target our messaging and education to our members. It streamlines that enrollment process. And the last survey I saw was 85% of all employees don't know if they actually made the right decision on open enrollment. So we take that guesswork out of there. And then all we have to do is educate them on the plan so they can maximize their benefits. So when you do that, and to be in a private exchange environment, it doesn't fit because we don't know who we're targeting. What we can do to make it a quasi-private exchange is what I had said earlier, is to add in those ancillary benefits, add in the life, add in the disability, the cancer, your critical illness. So when they go out there, they can choose on their ancillary side if they have dollars to spend.
I got it. Yeah, I got it. Very interesting. So tell me what the team is behind this. Then we'll tie it down. Let you leave us some takeaway. I mean, what's the genesis of this? I mean, and what's the leadership team around behind EndeavorPlus?
The genesis is our CEO decided when he's come from the financial markets and also the TPA markets, and he's the marriage of both of those industries. He looked at the ACA and he was looking at what the commercial carriers were doing, and he knew that with the reference-based pricing and value-based pricing being pushed by CMS to take advantage of that, and then we had the standardization of reporting so we could do quality measures. So that we've incorporated that. So we have true price transparency and quality control measures when people shop for their care. But then he also he took advantage of his financial services expertise and came up with that bond market play, which helps stabilize the rates. So that's why we figured the 50 to 250 marketplace is ripe for what we're doing here, because we can help stabilize those rates. When we married those two components together, we came up with something extremely unique. The way we handle our reference-based pricing is I've never heard of a way to do it in the marketplace. We actually flipped reference-based pricing on its head. And to be able to stabilize the rates through the capital markets, we're really given a good entryway into the self-funding arena to these fully insured companies.
It's good stuff, Daniel. It's been a pleasure having you on. I want to, stay connected with you guys and follow what you're doing. Leave our audience with a few takeaways, if you would, and then let them know how they can get in touch with you.
Sure. The takeaways is a fully integrated solution that focuses more on wellness than in sickness, that is a comprehensive health care package that includes vision and dental in one chassis. It is a qualified high-deductible health plan with a funded HSA, which drives true consumerism from day one, but we also have the resource and the tools to back that up so the consumers can be true, educated consumers on the back end, something that really has been promised but never been delivered in the marketplace.
Good stuff. And how can they get in touch with you?
Our website is EndeavorPlus.com. They can email us at info@EndeavorPlus.com, or they can also contact us directly at 877 EHP WELL, WELL.
Dan, it's a pleasure having you on. Look forward to staying connected and following your progress. You have a great weekend up in New York, and we'll talk again soon.
You too, and thank you again for the time.